It's day 7 of India's 21-day lockdown to stop the spread of the novel coronavirus. I'm Suraksha, and over the next few minutes, we will bring you updates regarding the spread of this virus across India with specific focus on Bengaluru and Karnataka. At the time of recording this video, 1,511 cases have been recorded in the country. 1,308 people are active reported carriers. 157 have recovered since they were first tested. The death toll has climbed to 46. Till date, 42,788 tests have been done across the country. 4,346 tests were conducted yesterday alone. Private labs have conducted 399 tests yesterday. Kerala reported 32 fresh cases today, bringing its tally of active cases to 215. Maharashtra has reported 59 fresh cases today. The state now has 254 active cases. Acknowledging the grave situation, the city corporation in Mumbai has authorized the requisition of empty residential buildings, lodges, hotels, cruise ships, among other places with immediate effect to arrange for quarantine and isolation facilities. Indore reported 17 cases today and Madhya Pradesh has 61 active cases so far. Andhra Pradesh reported 17 fresh cases today and all of them have returned from Nizamuddin. With this, the state has 38 active cases so far. Punjab has 36 active cases and the state government has extended the curfew until April 24th. West Bengal, Kerala and Madhya Pradesh have reported one death each today. In Karnataka, the number has touched 3 digits with 8 cases being reported today. The tally has now reached 101. 2 patients are now in the ICU. The state has 90 active cases so far. This includes 3 deaths and 8 discharges. It has also been decided that hydroxychloroquine prophylaxis will be given to all health workers and contacts in Karnataka. Hydroxychloroquine prophylaxis remains a controversial choice as it increases the chance of arrhythmia for those with a history of heart ailments. Among the 8 new cases, 4 are from Bengaluru and 1 each from Chikbalapura, Dakshina Kannada, Uttara Kannada and Kalaburagi. None of the 3 cases that came in from Hospet late last night have a travel history outside India, but they did travel to Bengaluru in mid-March. Investigation is underway to ascertain the cause of the transmission. Patient 95 and 96 are residents of Mysuru who had contact with patient 52 and belong to the same Nanjangud cluster of the pharma company. It is still unclear how patient number 52 contracted the virus as he has no travel history and neither is he a direct contact of someone who does. Yesterday, it was announced that the pharma company was looking at transmission due to infected packages from China. Javed Akhtar, the additional Chief Secretary of Health in Karnataka, has confirmed that the packages received from China are not the source of COVID-19 in this cluster. The source of the infection is yet to be discovered. He has also denied local transmission as a large group of people have not been infected. In Delhi, 24 people who attended the religious congregation Tabligh-e-Jamaat in the Nizamuddin area have tested positive. 1,548 people have been evacuated from the Jamaat headquarters. Among them, 441 have shown symptoms and are in hospital. The rest are in quarantine facilities. India is likely to blacklist about 300 foreigners who came from 16 countries, including Malaysia and Thailand, on tourist visas, but attended the congregation since the congregation has become a key source of the virus in the country. These foreigners were among the 8,000 people who attended the congregation in the second week of March. At least 10 people, including 6 from Telangana, 1 each from Karnataka, Maharashtra, Tamil Nadu and Jammu and Kashmir have already died after attending the congregation. Home Minister of Karnataka, Basavaraj Bommai, said that most of the 50 people who came to Karnataka after attending the Jamaat were foreign nationals. Among them, 11 are from Indonesia, 10 from Kyrgyzstan, 1 from France and Kenya. All of them will be placed under quarantine. 78 people from Karnataka are said to have attended the Tabligh-e-Jamaat according to the health department and have been quarantined. Those in Karnataka who attended the Tabligh-e-Jamaat in Delhi are requested to call the number on your screen for immediate testing and contact tracing. The congregation was held between March 8th to March 20th according to the State Health Department. The Supreme Court has asked the union government to ensure sufficient water, food, medicine and beds to hundreds of workers housed in temporary shelter homes across the country. While the bench of Chief Justice S.A. Bobde and L. Nageshwara Rao agreed with the centre's contention that the exodus of migrant workers cannot be allowed as the virus would spread to rural areas, they also noted that panic may kill more people than the virus. The bench asked Solicitor General Tushar Mehta to ensure the centre as well as the states that they employ counsellors, including religious and community leaders, to reassure them. A 20-year-old in Bihar Sitamarhi was beaten to death after he informed the district control room about two suspects who had recently arrived from Mumbai. As an act of retribution, the two men beat him mercilessly, killing the young man on the spot. This is the first such incident in the country. Several public sector banks announced a moratorium on term loans from March to May, following the RBI's guidelines on March 27th. However, there is still some confusion as several customers have received messages from banks regarding payment of EMIs. This is because each bank has to approve the moratorium decision at a board meeting, and in several banks, these meetings have not taken place due to the lockdown. The decision to avail the offer has to be conveyed to the bank by the customer. At the end of 3 months, the customer has to pay the cumulative interest of the EMIs. The waiver does not apply to credit card loans. Does your driving license expire, or is it going to expire between February 1st and June 30th? You need not worry. Since a large number of motor vehicle owners are not able to renew their expired documents due to the lockdown, the Ministry of Road and Transport has issued an advisory to all states and union territories to extend the validity of the documents. The documents, including all types of permits, driver's license, registration or any other document that comes under motor vehicle rules, will be exempted. It's not just people who have been hit hard by the lockdown, but also stray animals that depend on human activity for their survival. Keeping this in mind, the Odisha government has sanctioned 54 lakhs from the Chief Minister's Relief Fund to feed stray animals across the state. Including Bhubaneswar, 5 municipal corporations and 48 municipalities will get between 5,000 to 20,000 rupees per day so that the stray animals won't go hungry during the 21-day lockdown. Moving on to operations in Karnataka, the Health Department has clarified today that not everybody needs to wear a mask. The clarification came after many people were stopped on the roads by the police for not wearing masks. The latest clarification issued to departmental stores and commercial establishments says that only those with symptoms of cold, cough, fever and other respiratory illness need to wear a mask. N95 masks are mandatory for health workers and those caring for COVID-19 cases. Long queues were seen outside shops in Mangaluru as the Dakshina Kannada administration relaxed the curfew for a few hours to help people buy essential commodities. Locals claimed that despite enough stock, vegetable prices were being inflated. There was crowding at several markets despite emphasis on social distancing. Staying with Dakshina Kannada, the district's Belatangadi Taluk is now using an app to keep track of people under home quarantine. The app called COVID-19 Home Quarantine Beat Tracker has been installed on the smartphones of beat police, ASHA and health workers. The frontline surveillance staff who visit the houses can update the data online, and the information can be gathered in the war room that Belatangadi MLA has set up at the Vidhana Sauda. The district administration and the Department of Health has set up 13 fever clinics in different parts of Dakshina Kannada district to provide primary assistance. In Bengaluru, the Central Crime Branch Police raided a company manufacturing fake N95 masks in Kalyan Nagar in Bengaluru. The police seized 12,300 masks worth 20 lakh and found that normal cloth branded with a fake N95 seal was being used to make these masks. According to the police, the accused have already sold 70,000 such masks worth more than 1 crore. Before we go, if you live in Maharashtra and plan to use the coronavirus in your April Fool's Day messages tomorrow, think again. Maharashtra Home Minister Anil Deshmukh urged people to refrain from sending April Fool messages and rumours regarding the virus, and those who do would invite action against cybercrime laws. That's all we have for today. Stay safe, stay indoors, and we'll see you tomorrow.